today, we're kind of following up on the last two lectures. The first one on qualitative methods, it was an overview, and the first one on quantitative methods as an overview, and then that was followed by qualitative methods last week as an overview. And now we're going to talk about how to use a mixed method approach, because very often that's really what we do. Sometimes people think of that as a kind of a triangulation process. It's using two different methods and using them very often to corroborate or to inform a second method. So here we have...
Alejandra, it's not a full screen yet, honey. We're still seeing there you go. Now we've got a full screen.
So it's a method in which you're using both quantitative and qualitative approaches in a single study, and you can use them in a variety of ways that I want to kind of go over with you during the time that we have. We often use it in very traditional research to validate one of the methods, or we might use it to what we call corroborate the methods. It really tends to strengthen our overall research, and sometimes helps to provide a context, particularly if we're using a lot of quantitative methodology, to have qualitative data included to build out the context for the work. So in most cases, I think reviewers think of it as strengthening the research. Next slide, please. So we know that we begin research with at least one question, and sometimes we divide that question into studies or phase 1, phase 2, etc. But we want to be really careful when we decide on which method and how questions will be answered, and how we examine different parts of the question. So sometimes we have this overall larger question, and we subdivide it, and then we use different methodological approaches, quantitative or qualitative, to begin to answer the components of the question. That's a general way we do. So I often use, I have a larger question. One of the big questions I was trying to figure out some years ago in terms of religious organizations and their leadership in the community, and what roles those religious institutions play in HIV and AIDS prevention and intervention. And so that's a really large question, and I wanted to subdivide it. And in each of the subdivisions, I had what I called study 1 and study 2 within the larger, broader research question. And then with both of those studies, 1 and 2, I used different methodological approaches, one very quantitative and one very qualitative. And then I had to figure out how to bring it together. So that's one way to kind of think about the different methodology. I see something that says that I might lose my sound. I certainly hope not. Next slide. So the characteristics, and which we're going to drill down into now, and I talked about a little bit in the last 2 weeks, is we think of quantitative as being more closed-ended. If it's a survey, we're thinking about questionnaires that have what we call forced choices. We have categories of choices, and usually we use quantitative data gathering in surveys when we know a lot about what we're trying to study. So we already have a sense of how people answer questions, and so those choices then are put into the question. When we don't know a lot about how people feel about a particular issue, we usually use qualitative kinds of open-ended opportunities so that people can kind of talk about the answer to the question, and we tease out over time the kind of terms they use or the descriptors they use so that we can eventually take that qualitative and put it into a more quantitative forced choice type of data gathering. So that's another way. Both of them are important. Both of them are very helpful, but they're answering different kinds of questions. And we talked about that a lot in the last 2 weeks. So we're going to now talk a little bit about whether we do the quantitative and qualitative methods concurrently or sequentially, whether we use the same samples and we ask them open-ended questions and then ask them closed-ended questions in a more quantitative way. And we can think about using the methodology in the beginning or in the middle or at the end of our study design. That's up to us, but we should think about it strategically in terms of how one type of data strengthens the other set of data. One of the things that we're most familiar with, and it sounds like that might be happening with the group that was talking about the poll, was that we often use our qualitative data gathering to inform a more quantitative survey. So we start with focus groups, we start with open-ended data, and that helps us with smaller groups to think about and to plan for collecting data from larger numbers of people, which necessarily, because of the methodological approach, requires that we try to do quantitative closed-ended kind of surveys. So also the kind of question and the sampling, the number of people in the sample, the ease with which we can recruit often helps us to think through what methodological approach and in what sequence it's going to happen. Next slide. So we think about this mixed method approach as being able to help us do certain kinds of things. And often I use the word triangulate before, is to help us validate our findings and to help us corroborate the validity of our findings. Often very, very helpful for that. But regardless, each of the approaches that we use, quantitative and qualitative, usually comes with threats, and by corroborating data, it helps us to reduce some of those threats. So I think in the beginning of working on a doctorate and having a thesis or dissertation that you have to support, they'll often tell you, be sure to build in multiple or mixed methods approach so that you can show that you are substantiating or validating what it is that you're doing. Don't just use one methodological approach. And that's what you hear more and more today, because reviewers want to see that you really have substantiated what it is you're finding. So that's going to be important. It's also important when you think about your approach, which is before you ever get started, you don't want to think midstream about, well, we need to bring in other data or other approaches. You want to really think it through at the very beginning so that you're answering the questions that are relevant to your overall aims. Next slide. So I talked about the fact that this mixed method approach can add credibility. It can help to provide context, and it also improves the utility in your research very often. We think less on the utility, but certainly on credibility and helping us to understand the context and be able to talk about and interpret what we are finding. It also helps us to discover and confirm. So when we're really trying to think in terms of, generating hypotheses from our data, being able to use multiple methods to get at what it is we're trying to look at, the phenomena that we're trying to investigate, it's really very helpful. The other thing that it can do is when you're weighing, the these hypotheses together, that you're looking at the relationship between variables, and having a mixed method approach helps you to kind of think through and discover and investigate your variables. Next slide, please. So here I have a schematic that I often use to kind of talk about how you can think about the mixed method approach and utilizing quantitative or qualitative methodology, and how, you know, somewhere in the middle you have a pure mix. But what we mostly find is that people, you know, researchers tend to go more in one direction or the other in terms of both their familiarity, the expertise they have on their team, and the kind of questions they're trying to answer. So rarely do we see a pure mix, so to speak, but utilizing both methods, but leaning more towards one or the other. I think it's really good to take a look at this and kind of think about it in terms of your own work and how you will be able to kind of narrow down what you want to do in the small amount of time that you have to do it. And so what you don't want to do is to try to use so many different approaches, because it may seem attractive in terms of thinking about it, but you have less than a year to do the work that you're going to do. So you want to think about what you can do well in that amount of time, but yet use another perhaps methodological approach to help either validate or corroborate what it is you're finding. You want to be careful with this. This is great to do. It usually takes more time when you're going to do a mixed method approach. So I'm not suggesting that that's the best way to go, but it's very frequent. But usually you have a little more time than most of you are going to have with your study once you start going through the IRB, et cetera. It does take time. Next slide, please. So let's look at the exact design. The sequential design is a really helpful one, because it allows you to use one method right after the other. You can keep them straight. You're not trying to do something concurrently. And if you have a small team, that might be a better way to sort of organize, is to use one and then the other. It's easy to organize, but it increases the duration of the study overall. So a lot of times when we're using mixed methods, we're doing some overlapping of the methods. We're able to, you know, not have perhaps gone all the way to saturation with our focus groups when we begin to at least pilot our survey and see how that's working with a few members of the community that we have targeted for this approach. So it's really kind of interesting. It makes it a little bit longer. That's why I say you don't have a lot of time to do this. You might want to do something that is concurrent rather than needing sequential, because of just the time consideration. One of the things that you might do together, but see, one, it depends on how you talk about it, because one approach helps to inform the other. So I mentioned at the very beginning, as an example, using qualitative focus groups or in-depth interviews to help to inform what's going to be a quantitative survey. But that's going to take more time. So that may not be the best thing in this particular instance. You may have some preliminary data already that you can use for this, but otherwise, you know, you might not be able to have the time to do sequential. So another thing you want to do when you're writing up your proposal is to do a timeline for yourself that's realistic, and think through, are you going to be able to collect data, you know, as somebody talked about, develop themes, et cetera, you know, really go through transcripts and do the necessary analysis and utilize that to then be able to mount a survey. So think about it that way. The concurrent designs lets you do some parallel and triangulation in your design, or you might do a nested design where you're doing one overall approach. Maybe it's quantitative, but you have a focus group that's giving you data in that same time frame, about that same time area. And in these designs, as I've talked about them, we're thinking about using different samples for each of those designs. And that's another thing to think about too, is whether or not you want to utilize the same people in each of those areas or approaches, or whether you'd use a different group of people, a different sample for this. And that's important because when you think about it, we have to be careful that we don't burden our respondents or our participants to the extent that they're participating in several different waves of the study or several different trials of the study. We want to be really careful about how we approach and have participants in our groups. So again, you see pros and cons in both, and you want to be careful about both. Next slide. Are there any questions on this so far? Okay, so sometimes in our design and sequential designs, we're looking for exploration or explanation. And depending on whether your questions are formed such that you're trying to find exploratory or explanatory designs, you will think about how this might be done. So I gave examples here. If you are studying stress, or you're trying to examine or assess stress among new RNs, and you're using quantitative national survey of ER RNs to measure stress levels, that would be one set of data. The second set of data might be interviews with RNs to look at their experience. And one of the things you'd want to see is how similar their experiences are to the national survey data that's already available to you. And that would be a very interesting study because you already have the national survey collected. You'd want to be careful that it was within a time frame that makes sense. You wouldn't want data to be too far in the past because it might not be relevant or as relevant, and that's something that could ding you. But if you had some really current data and you were able to take a sample of that data and compare it to interviews you were getting currently, that might be an interesting way to begin looking at some issues that you have drawn in terms of stress for RNs. An exploratory sequential design might be one in which you do the following. You're looking at the highest workplace stress for RNs, and you have focus groups as a qualitative way, and they discuss their experience with stress. And then you use another set of qualitative data to inform the development of the survey that you're going to use. So this is just talking about how you can use sequential designs, which I said take longer, but allow you to answer some interesting questions. And if you have some data that has already been collected, like the national survey, then it might not take as long as if you have to collect it as primary data and two types of data. So it's kind of an interesting way to think about the questions that you've already formulated and what kind of design you might use based on both the time frame, access to data, expertise in your team. Any questions on this? Okay, next slide. Then we have the concurrent design that I mentioned before, which allows you to look at data, quantitative and qualitative, but at the same time. So that's really more demanding on your team, but certainly time saving. So again, using the RN example and the sources of stress, you're looking at coping strategies and support systems provided by the hospital as a qualitative, and then the quantitative is looking at the national survey of RNs working in the ERs. Again, you have maybe focus groups with a random selection of RNs and hospital administrators, they might be easier to get, and then you're using the national survey. So this could happen simultaneously because the national survey is already there to draw data down, and you're just doing the focus groups. But again, you're utilizing both of those data sets to be able to answer your question. So it's always easier if you're going to use quantitative and qualitative if some of the data is secondary analysis, because then you've saved yourself some time and you can do them both at the same time. Oftentimes in the survey research that I've done, our team has utilized national data. Sometimes it's useful, and other times it's not as useful, depending on what subpopulation group we're using. So for instance, in the RN studies, it pretty much works well because you're looking at RNs by definition and training. But if we are looking across a population, and let's say we're looking at Dominicans as one of our groups is, and you look at some of those national surveys and you see the number of Dominicans represented in those large data sets, and you want to be careful about how you draw down, because you may not have the diversity of the Dominican population represented in those national surveys, that you really feel confident that what you're seeing in that data would be a good reflection of what we would see, let's say, in Washington Heights or elsewhere in the country. So you really want to think about the data set and the data you're drawing down is appropriate or maybe not as appropriate. In the
Joyce,
nested, yes.
Oh, sorry, I have a question. In that example that you gave of using using national data, what you're and doing secondary analysis. So essentially, it would be acquiring the raw data that was generated from that, and then running our own analyses to answer a question that is relevant to the study that we developed. Is that correct?
Yes, yes. And I should have mentioned that you'd have to use a public use data set. So the National Study of Nurses is a public use data set. So you would be able to draw down what you need, and the documentation on the data set is thorough. But you're raising a really good point, because what I didn't go into detail and talk about is the fact that some data sets that are available for public use don't necessarily have the level of data or the level of documentation that would be needed in order for us to feel confident in using it in secondary analysis, and that's something to look at. So for instance, an example of that, which I think has been corrected now, is the BRFS data that gets collected, I believe, every 2 years. And we were looking at it for New York State, and then New York City, and then Harlem. And we recognized that we didn't feel confident in using that data for Harlem, and that we felt that we needed something that was more representative of the communities, the individual communities that we were looking at. And so we went to the city that did their own similar survey to the BRFS, which is state collected data. And we found that it more closely drew from the communities that we were interested in. So even though we have the national data set, it wasn't as informative. We didn't feel confident that it was representing the communities to the extent that we could really draw from it and have usable information. So a lot of times data that's at the national level is collected with the recognition that it's used at the national level. But when you start drilling down and try to use it to answer questions at a local level, sometimes it's not as useful. So you want to really be careful of that. And there's a lot of literature written about that fact. But it depends. But yes, you draw it down. You can draw down the raw data and analyze it in whatever way you choose after you've downloaded it.
Thank you.
And so there's the nested design, which uses qualitative and quantitative methods, but they're nested into the design itself. And this one is a little more difficult. I have not used the nested design before, but in this instance, which I pulled from the literature, they're talking about something like using a randomized control trial to test online peer support programs. Now it's interesting. So they're using focus groups embedded in the randomized control trial to do some kind of assessment of the user experience of the online program. So this is kind of interesting, and that's one of the reasons I pulled it, because I thought, I'm not sure exactly how. I really would love to know how they actually did this, but it just goes to show you that you can utilize something that's a very quantitative method and then use focus groups to kind of try to understand how people felt about and what their experience was in being in an online program. So there are many, many ways that we can utilize the mixed method. And while we're more familiar with the sequential approach and using, qualitative focus groups to help inform quantitative surveys, there are many, many ways that you can both triangulate and utilize mixed method studies. Next slide. So you can utilize mixed methods at various times in your study, as I mentioned previously. And one of the things that was mentioned early on about the poll is, you can use mixed methods in generating your conceptual and thinking about your conceptual framework or the formulation of your hypotheses. And right at the very beginning, when you're brainstorming and thinking things through, it's really important at this, like the point that you're at now, that you're kind of going through the literature and making sure that you are picking up on how you want to nuance your question, how you want to frame it, how you want to set it up. It's really helpful to look at that and maybe collect some data. We used the word earlier about informal data, however you want to think about it. You might talk to other investigators that have done similar kinds of work and do some secondary analysis of some preliminary data that they've gathered, but you want to really kind of think through your process and the information that's available to help inform you, so you're not always starting from scratch. It's really, really important if you have data available at the very beginning stages, because you might fine-tune what it is you want to look at or you want to think about discovering because of data or information that could be available to you. You might use this approach in the selection of your subjects or deciding on the unit of analyses. It could be helpful there. It could certainly be helpful as an evaluation design. It could be helpful in data collection and recording methods, and in triangulation, as I mentioned before, as well as in data analysis. So you can use a mixed method approach in almost every stage of the research, as long as you're able to talk it through in your proposal in meaningful ways. As I said last week, and I'll repeat again, you don't want to put in a lot of approaches because it seems elegant and makes it more sophisticated or complicated, because if it's too complicated, reviewers tend to frown on it, particularly when you have a year or two of funding. Even 2 years of funding is not a long time if you have a really sophisticated methodological approach. So you want to think about being able to do work that's clear, that allows you to come up with some findings that generate the next proposal, and not have something that's so elegant that you actually overshoot the skills of your team and the time that you have to do the work. Next slide, please. So in the next slide, we're going to talk about merging the data. That is, how do you move from and report on the data? Well, the integration of the data has to do with how you have designed it and how you rationalize its use. You should already be thinking through how you're going to utilize the quantitative and the qualitative data. So there are various ways. Sometimes we use quantitative we report on quantitative data and then use qualitative quotes as like themes or thematically. That's helpful, and a lot of times the themes may support or refute something that you found, which allows you in your discussion to really talk about that and its meaningfulness, and that can lead to further development of aims for the next study. You also could transform a data set into more qualitative information and vice versa. But a lot of the purists don't like it when you take qualitative data and quantify it. If you do so in terms of being able to be explanatory, that might be all right. But you want to be careful about taking qualitative data and assigning numbers to it. It should be done in a very careful and meaningful way. I've seen reports dinged for that matter for, when an ethnographer has said, how could you try to give an explanation that's quantitative to qualitative information? So you want to be careful about that. But other ways that you can use qualitative data is to chart it or to develop pictorials so that you can think about the data in other ways than just the words or the numbers that are presented. Next slide. This slide I hesitated to include, but one of the reasons that I had selected it early on is because when you get a chance to look at the slides on your own and you can actually see this a little bit clearer, you will note that the information is provided for a study that was done in several phases, but it also provides the way that the approach allowed for both quantitative and qualitative data, and in the discussion, they talk about the quantitative and qualitative data and how one set of data informed the other. It's exactly a good example of how to use multiple methods to try to get at findings. And so I wanted you to kind of see an example of how somebody put this together. But it was very compelling, and it was very sort of stepwise progression. It also, because it divided the study up into phases, the data gathering and how they talked about the data, I thought made a lot of sense. So this will be a good example for you to kind of look at. And then after you've had a chance to look at it, if you have any questions on it, I'd be glad to go over it with you. But I think it's a great example. Next slide. Okay. So connecting the data is really involving like a quantitative survey, informing other data like the interview questions, the identifications of participants. One of the things that I used that's similar to this, I used quantitative data from a phone survey to identify types, categories of people that I would want to have participate in a focus group. So I wasn't sure. I was looking at a geographic community. I wanted to understand their experience doing something, but I didn't know how they might be grouped. And I didn't want to just have people come into a focus group and not have a homogeneous focus group. So the way that I had to do that is to figure out, well, how do I categorize people so that I know how to select or sample for the focus groups. So doing the survey first was an important way of thinking through getting information so that I can categorize people based on what they say their experiences are. So that people with common experiences would be asked to be participants in the focus group. So it helped me to identify participants for the various types of focus groups I was going to hold to then begin to assess the kind of experiences they have. So it was quantitative to qualitative. Next slide. So another form, and we talked about embedding the data before, is having, it's sort of like, do you have the qualitative supplement the quantitative, or the quantitative supplement the qualitative? And I have done it both ways. The example I just gave you was moving from the qualitative to the quantitative. I'm sorry, from the quantitative to the qualitative. So it was from the phone survey to the focus groups. But a lot of people do it in reverse. They do the qualitative first to inform the quantitative, and vice versa. The point here is just that you want to be clear on what you're doing and being able to explain why it is you're doing it that way, how you're going to analyze the data. All of that has to go in your explanation in your proposal so that it makes sense then when you get the data out. Are there any questions? You have about 2 minutes. Okay, next slide. Okay, so I mentioned this before, but there are a couple points that I didn't mention in terms of advantages, and that is it's an opportunity very often, depending on how we design this, to gather participants' point of view. It also allows us to foster a lot of scholarly interaction by using different methods and bringing in different providers or investigators who have different skills in this. And I've talked about bringing in an ethnographer. I've talked about bringing in an anthropologist. It's been really important depending on what we were looking at. And then the other thing is that I think it provides for a comprehensive data set, and it allows you to be able to look at context in ways that you couldn't if you were only using one method. And so I think that that's really important. It allowed us to be able to write more papers in this regard because we had the several methods, and also the ability to draw in more people to be involved at the community level in helping us to understand and explain the data that we had. Next slide. It also can increase the complexity of not only what you're finding, but also the needs of your team. And it does more often lead to a multidisciplinary team of researchers, not always, but sometimes, and I think that that's helpful. We do know that it's more labor intensive, and it's probably a little bit more expensive and requires more time. Next slide. And then I showed you this last time, I think, this schematic, and I brought it in again this time to kind of think about what methods you're using and where you bring them in, and how they can inform each of the other methods and what you do. And I think that it's good for you to take a look at this. Next slide. I think that's it. I think we're finished with the slide. Are there any questions or comments on this? Because I do know that you will be working on this over the next 2 weeks.
For example, did a study where we used 2 different qualitative methods. So being mixed methods isn't only qualitative and quantitative, it can be 2 different qualitative methods. We did interviews, for example, and we also did focus groups with a related group, but not the same group of people.
Yeah, that's true. And one of the things that you made me think about was the challenge of being able to pool the data in a way that one set of data helps to inform or strengthen the other set of data, as opposed to thinking of this as, well, there's like 3 different ways that we wanted to answer this question, and so here are the 3 ways, and we're not linking them, we're not showing what was the purpose and why have these there. So you want to make sure that you make the connection, but you want to make sure that you talk about it in your proposal is the way you're going to use it, not just throwing in the methods. That goes back to something else you said earlier, Fern, when you were answering the question about the CBPR approach.
Mm-hmm.
Oftentimes, too often, we find that the initial proposals say that we're going to use CBPR, and CBPR is important to use. And those are the sentences. Or here are the most important principles of CBPR. What the reviewers are looking for is not to see that you can regurgitate what's in the textbook about CBPR, but they really want to know your application, your operationalization of it. And so that's one of the things that you were trying to say, Fern, is just that, how are you using it?
Right.
It's really what your approach is. How are you using this? And so in most things, in the few pages that you have, that's what you want to do, as opposed to, quoting, principle 1 and principle 2 and principle 3 that, might have been talked about in the literature about CBPR. It's like, how is it that you're using this? You remember those initial proposals, Fern?
Oh, yes.
It's like a whole, a whole page on what CBPR is, and the reviewers really don't want you to tell them that. They want you to tell them how they're using it, how you're using it.
Especially in this context, because all of the reviewers know that you're taking a CBPR course. So they really want to see that your level of understanding of that is something that you can present. That, for example, we're drawing the sample of participants of our study from the community organization, or we're holding focus groups partly at CCPH and partly at the community organization because we want to draw participants from 2 different groups so that you're actually speaking to what you are doing and not just that there's a sense of equality and participation. Thanks, Joyce, for giving me the opportunity to expand a little bit on that. Other questions up to this point?
Oh, it was me, Krishna. That's okay.
Krishna, go ahead.
I just have a question. If you have any textbooks or papers that are more detailed in terms of qualitative research methodology that reference?
Yeah, we do. And I could put those in. Let's see. Well, one of the classic books is a book by Yin, Y-I-N. He's a classic in qualitative methods. It's not going to touch on CBPR, but it's certainly one of the texts that is almost always recommended in doctoral programs for people who are doing qualitative research for their dissertations. So that's a good one, and there's several books. And then Sage Publications puts out a whole series of research methods books, and one in particular on qualitative methods. I'll try to get the number and maybe now for the next few minutes and put it in the chat, because their series is excellent. And if you don't have a lot of time to do a lot of reading, probably the Sage Publications is the best way to go to get a lot in a few pages. Definitely. And then I
It's
think Patton,
it's Robert Yin, and the book that comes up most is Qualitative Research from Start to Finish.
yes, that's the one. Thank you, Fern.
Mm-hmm.
That's really sort of like a Bible textbook kind of thing, in the sense that it's well recognized in literature. And then the other one was the Sage publication on research methods. They have a whole series on qualitative.
I'm going to take a look right now.
And then the other really great text is
the Sage Handbook of Qualitative Research.
Yeah, that's
And
really a good one.
Both books are certainly available on Amazon, and I would assume in the library as well.
Yeah.
And Sage does have a whole series.
Yeah. It's worth getting if you really are in the field and you want to do, other than RCTs all the time, which there's a lot of documentation on those. But I would suggest the Sage series. They cover both quantitative and qualitative, and they have at least one book, if not several. And these are small books. I mean, they're not real thick. They're paperback. They're, some of them are like 100 pages or something like that. It's not really a lot for text. But it's a really good textbook that's an easy read and covers a lot of this is by Patton. I can't remember his first name either. But he has a textbook that some people that prefer text with maybe questions in the back and stuff like that, that would be Patton's book. So those are the three recommendations: Patton, Yin, and the Sage methodologies. Any other questions or comments?
I have a question, and hopefully it's an appropriate question to ask. We're going to look at the prevalence of social isolation, possibly but I noticed that reviewing the literature quickly, there's not a validated study, a validated tool specifically, because someone writes about societal, psychological, and spiritual, and we don't see any validated tool for the spiritual one. How would you go about, do you think it would be too much to try to create a validated tool for this program, or how would you go about it, if it's okay?
All right, so a couple things. One, I'm not sure where you looked, but the Pew Foundation, PEW Foundation, they're out of Massachusetts. They do a lot of religious studies and surveys. They have one on the national churches. I've drawn from them a lot. I don't know that I've seen anything specifically on social isolation, though. So the only place that I would know to begin, I would look at Pew for that, and I would look at Pew also. They do a lot on, like national surveys and who participates. And so the question, I was looking just for this class because I was concerned about the polling and who would be included and excluded from a poll if you were to conduct a poll, a national poll, through some kind of public use website. So that was for a question that came earlier today. But Pew also does all this work on religious studies and religion in churches, and their national studies. They collect a lot of resources on that. So you could look at them to see if there's anything on social isolation. But other than that, there is a measurement group, social science measurement group. And I'll see if I can look that up. Fern, maybe you could look at that up.
So,
So
so
it's
I
going to
can,
it's called,
so I think you guys are working with older adults, if I remember correctly. And there's trends in loneliness among older adults from 2018 to 2023, which is a national poll out of the University of Michigan. And if you can't get their measurement tool, I would reach out to the principal researcher and ask. There's also an epidemiological study by the National Institutes of Health, but that's older. It's from 2011, which was published in 2018, but it did have religion as one of the cohorts regarding the prevalence of social isolation. And I know that the CDC did something on the health risks of social isolation and loneliness, but I don't know if they tied it to religion. I know the NIH one did.
so that's interesting to know the NIH one tied it to religion. Because you're
Mhm.
tying yours to religion, right, Lucy? Or no?
So it's spirituality, because religion is underneath the umbrella of spirituality, but it doesn't
Mhm.
encompass everything. And then the New York Academy of Medicine had a forum because it's the increased rise of social isolation.
Right.
And
Right.
Project
I saw
Unlonely
that
by
they were having
Noble,
it.
yeah,
Mhm.
by Noble, he has it in three frameworks, those three frameworks, but I don't see that he used a validated study for that.
Um,
But they do
one,
talk about the other studies, validated
um,
tools.
I'm sure you probably may have already seen this. One tool that I'm familiar with is a loneliness scale. That's UCLA's. I think it's a 10 item and and there's a 3 item, I believe. Um, but I'm not sure, and that's obviously validated, but I don't know what the original study population was.
Right. I think teasing out spirituality is going to be harder because that's not necessarily a term that is used, because what they usually measure is frequency of being at a religious facility. So I'm not sure that there's anything that's as broad as spirituality, but you'd have to look. Any other questions that we can approach it?
So in terms of, again, measurements, there's a group called the Measurement Group, LLC. And at least over the years, they have kind of compiled instruments on health and social service and evaluation. They just have a collection of tools, and they say, whether the tool's been validated, the groups they've been validated on. So it's a place that social scientists often go to see what kind of measures have been used. And they will often pull from there because they do give the test, the reliability and validity test scores, so that you have them to be able to include in your studies if you want to pull from their instruments. So that's another place that you might want to look.
So when I added spirituality to my search, I got two things that I didn't see before. One was also NIH, the role of religion, spirituality, and/or belief in positive aging for older adults by Jay Malone. And the other one was a case report. And that case report is tied to cognitive impairment in the patient. So definitely continue your search, including spirituality, because it looks broadly like these are saying that the more spiritual you are, the less socially isolated you are. And those are pretty recent. Both of those are pretty recent. 2023 and 2024. The one about the case study is about COVID. And I can just tell you anecdotally that participants in senior centers who are more spiritually connected, or feeling less isolated. Any other questions that we can address at this point?
I had a couple of questions.
Yeah, go ahead, John.
So for a qualitative study, how do you know, like, how many subjects you need to interview to make it, valid? Like we're thinking of interviewing 20 people altogether. So maybe 10 people who had doulas and 10 people who didn't about their birth experiences. But how do you know, like, is that a big enough number? Or does that just, I mean, obviously more is better, but we have only so much time and so many resources. So how do we determine the sort of the ideal size?
Well, that sounds more qualitative than quantitative.
Mm-hmm. But that just in terms of recruitment, like how do we decide how many people to include? And the other question is that because birth experience there's so many variables, would it make it more valid to limit it, say, just to like one hospital, as opposed to women, delivering at various hospitals around the city? Or would it limit it too much?
So let me just begin throwing a few things out, and it's good to hear from others online. But one of the things that we always talk about early on is the diversity among those people in that group. So your second question had to be, was whether it could be from one hospital or multiple hospitals. The question would be, is there a real variation among either the services at those hospitals or who would go to those hospitals, or is it generally the same? When you think about the population of people you're targeting, are they more similar, or are there a lot of differences? Should they be divided by age, range, by race, ethnicity, or culture? So that's a way of, because if you were trying to get the range of experiences of people, then you want to have a range of people that are in your group, and so you'll want a larger group. If instead your question is related to something that most people would experience similarly, then you would need fewer people. So that's one way to kind of start thinking about this. So when I was looking at my examples, when I was looking at Head Start children and their dental conditions, because I wanted to, I was hoping down the line to recommend bringing dentistry in as a covered service for Head Start children across the city. How many children do I need to know? How do I make that assessment? And so as I talked to, and this is why doing the sort of preliminary work is so important, as I talked to providers and I talked to people around the city, I was told, kids are not all the same throughout the city. And there are areas of the city where children have had less service. They have higher diets, higher in sugar content. You're going to get more baby bottle syndrome and therefore more deciduous teeth that are really, so they were saying you need to really sample from around the city in these places where there are a lot of these differences. So I started listening to that. And then I was told that, well, certain cultures utilize, sugary beverages to keep the kids quiet so they won't cry so much. So you need to consider. So as I started looking at the considerations, I started thinking, I want to hear from this kind of group and that kind of group. So the number of people that I really, and the number of centers and the number of places I needed to go built up. So it had to do with looking at those different characteristics and where I would find those characteristics. So in your question, while I'd love to just say, 20 sounds good, 25 sounds good, I have to ask a question that goes further back, and that is, are there a lot of differences? And, what are those differences? And so you want to have people that represent those differences if you're looking broadly about the experiences that people have. You know, 20 may be not enough. It may need to be more, and it may need that you need to really be selective in, you know, sort of purposive sampling of the type of people that you want to see represented in your sample. So
Okay, thank you. That's
kind of
helpful.
that's kind of how I had to answer that question. And then you can kind of narrow down by, after you think that through and you say, well, you know, there's basically, it's sort of like what I did with that phone survey I told you about the smokers, and I wanted to have focus groups, but I didn't know how many focus groups I needed. I didn't know how many kind of groups there might be. And I was able to, after asking a series of questions, realize there's sort of like 5 types of experiences around smoking among women that are between the ages of, I think I had 28 and 44. With the broad range of, you know, the experiences got to be the same, both, you know, after 44. So I could narrow the age group that way. And then after talking and getting some preliminary data, I realized that there's sort of like 5 categories of smoking or non-smoking experiences. And I could put people in those categories, a whole community into those 5 categories, and I would capture everybody. So then I said, I need to have at least 5 focus groups. Maybe I should have 2 focus groups of each of those 5 types. But that still, you know, gives me some boundaries. So that's how I began to think about it, and that's how I wrote about it. It's not a prevalence study, so I don't have to get, you know, huge numbers of people, but I want to think about, you know, what would be the minimum number to say that I really kind of captured full range of experiences of people. So the question becomes really important and helps to drive your numbers.
Okay, thank you.
Any other questions? I'm happy to
Yeah.
see you here, Angel, and I hope all goes well. And we will see everybody in 2 weeks.
Okay. Take care,
Thank
everyone.
you.
Thank you.
Bye-bye.
Thank you.